beautiful child, a beautiful baby, a beautiful child.
He'd been to us for a meal 2 weeks before, and he's bounding in. He looks really good. He's slim. He's smiling. He always gave us a big hug. And this kid 2 weeks later was dead.
Kazriel Benjamin was 25 when his roommate found him unconscious on his bedroom floor.
I mean, it pulled the rug from out of us altogether because it was so unexpected.
We didn't know he was using drugs. That was the first that we knew he was using drugs. The police told us he had overdosed.
The culprit, likely a mix of heroin and Xanax. Kazriel's fatal overdose was 6 years ago, and since then the nation's opioid crisis has exploded. But in the Benjamin's Orthodox Jewish enclave of Crown Heights, it's a story that is rarely told.
Within an insular community like here in Crown Heights, for example, there is this feeling that, you know, we are have a moral level, and drugs and stuff is way down at the bottom of where we should be. The idea that one person in your family had an addiction somehow taints the rest of your family, which has issues for a future wedding of a girl or a boy, or a position in a school, or any of these things.
Yehuda and Sarah Benjamin made a conscious decision not to keep their personal tragedy a dark secret.
Kazriel's death was not an isolated incident.
Earlier this year, Yehuda Benjamin spoke at what was billed as a groundbreaking event in Crown Heights, where 650 Orthodox Jews packed in to talk about addiction.
It really was out there for someone to get up and say, my kid died of a drug overdose. It's like, I don't think it had happened before in Crown Heights.
But while the Benjamins are some of the only ones in their community sharing heartbreaking stories of drug addiction, they are not the only ones living it.
19 years old, I was full-blown, all-out Roxys and Xanax and marijuana, mixing them and selling them.
Daniel struggled as an addict in the Orthodox community.
I don't think they knew how to deal with that at that moment. You know, the community would just close you out.
Now 25, he says he considers himself lucky to have found help that ultimately saved his life.
I know that at 24 hours a day, 7 days a week, even in the Orthodox community, I know I can call certain people on a Saturday, and I know that if I call them twice, I know they'll pick up, even though it's Shabbos and they keep the Sabbath.
But too many others haven't been as fortunate.
We have right now 88 deaths that we know of since January 1st, 2017 to date that are 100% opioid overdose related.
88 deaths of Orthodox Jews within the tri-state area is a low estimate, and it may pale in comparison to the national death toll of heroin and prescription pain pills, which reached 33,000 deaths in 2015, 5,500 of those in New York State. But the numbers and the stories that go along with them are staggering enough that this tight-knit religious community is now listening.
Is this at crisis level?
This is definitely a crisis. We term this in Hebrew a magefa. This is unproportionate to what we've ever seen before.
Rabbi Zvi Gluck is the founder and CEO of Amudim, a crisis intervention organization that serves the Orthodox community.
We have literally hundreds of people calling on a weekly basis specifically for addiction issues, asking for help.
This is the story of a nightmare.
Amudim created this dramatized YouTube video of a teenage girl overdosing, a scene that has played out in real life over and over again.
We're not angels. We suffer from the same problems everybody else suffers from, and addiction is no different.
Rabbi Yaakov Berman is the program director of Operation Survival in Crown Heights, which runs prevention programs and has trained hundreds of Orthodox to administer the overdose-reversing naloxone or Narcan.
I saw the need because people are dying.
While drug addiction is certainly not unique to the Orthodox community, Berman admits there are unique challenges when it comes to talking about drugs.
Because we're very careful with regards to exposure to the secular world. So a mother would be more sensitive in one of a Orthodox Jewish school to exposing your child to drugs. Why are you teaching my child about drugs? I don't want to expose him to that at that age or altogether.
Overcoming the shame and stigma of addiction is just part of the challenge. There are also issues when it comes to finding the right resources and the right kind of treatment.
I see much more people seeking help and there's no funding, or there's nowhere to go.
Many Orthodox Jews seek out kosher rehabs, and those are few and far between, often with long wait lists.
I wish it was as simple as somebody calling and saying, hey, I need an antibiotic so I don't get an infection, and here it is, and have a nice day. It's sadly much more difficult, and many times in the family dynamic, because of stigmas associated or the community's response overall, it makes it even more difficult.
But Rabbi Gluck of Amudim says he is seeing a shift. More people are reaching out for help, and more people are acknowledging this is an issue that needs attention, not covering up.
I'm not ashamed of him. Why would I lie about his manner of death? It's saying I'm ashamed. I don't want anybody to know, and I don't want to go, and he would have hated that.
For the Benjamins, speaking up about their son, Kazriel, doesn't lessen the pain of their loss, but it is helping them cope.
If I can do anything in my life that I have left, if I could even make a little dent in that, in the shame issue, maybe that's something that I could do.
There's always this layer, gray fog, unfortunately, over life. Once you lose one of your kids, it's never quite the same.
Stacey Delicat, Fox 5 News.